Hi, I'm Dr. Balanoff, and I want to talk about the steps that you're going to take going forward to reopen your office. And the problem is we don't even really know what they are. But I think together, collectively, we can kind of enhance what we each know individually, because we've been talking to different individual doctors and maybe we're getting some information from our local dental society or whatever. So let's do this. Let's collectively kind of put our thoughts together. I'm going to share 10 points, which are kind of generic, but there's going to be a lot of specifics as well. And I want you to consider these. What I really want you to do is I want you to add to the conversation within this posting right now. And if you have any questions or you have any particular questions about your own situation, give me a call, 954-683-2693. And I'm more than happy to talk to you about this. We never charge for consultations at Smile Perfected. More than happy to help you, because at the end of the day, as dentists, we have to collectively work together and support each other. So let's talk about the points to reopen. Let's talk about each of these individual 10 points. We're going to take them one at a time. Point number 1, communication. Who are we talking to? Well, immediately what comes to mind is the people we've really been talking to a lot over the last couple of weeks since we were all shut down is our office team. They want to know when they're going to get reopened. They want to know what the pay is going to be. They want to know a lot of different things. And I'm sure you've been on the phone with all of them, doing the best you can, explaining everything to them. What they probably haven't asked yet is how safe they're going to be when they reopen. And guess what? Your patients have got exactly the same questions. They want to come to you. The team wants to come into work. The number one question that everybody's going to have is how safe are they going to be? So let's talk about some of the safety measures that you could put in place. So what's the number one thing again? It's about safety for our patients and our office team. So we've heard that PPE, personal protection equipment. What does that mean to all of us? Obviously, mask. Great to have N95 mask, face shields, glasses, and some kind of barrier that we're going to wear over the top of us. There are some ideas, because you want to be able to change out the mask in between patients, but N95 masks are expensive and hard to get. So what some are advocating is you wear an N95 mask, and over the top of that, you wear a typical run-of-the-mill cotton mask that you can buy. You can change that one out in between patients, so there's no aerosol or spray or anything like that you're changing out in between patients. What's important here is you're going to articulate those things to your patients, which is how you're keeping them safe, and you're also going to articulate that with your office team. Before you open, you have to do kind of a run-through. You have to have your entire office team come to the office and say, okay, imagine we have a patient coming in. Mary, what is our protocol? And here are the things I want you to consider. Mary is going to report into the office or check into the office in her car. She's going to call you. You're going to say, Mary, when we're ready to receive you into the office, we're going to call you and you can walk in. The moment Mary walks in, she's not sitting in the reception area. She goes right to the operatory. I'm recommending a pre-treatment rinse of chlorhexidine. You're going to go ahead and perform the procedure on Mary. Mary is going to pay typically by credit card, or there's going to be some type of arrangement with her insurance company or whatever. Do not have Mary sit in the reception area or the checkout counter. Have Mary go back out to her car and deal with that transaction while she's sitting in her car. Once Mary is out of the office, patient number 2, John, now is allowed to come into the office. While Mary is leaving, before John comes in, you need to have a dental assistant who's dedicated to environmental hygiene. So what does that mean? That dental assistant is going to wipe the handles and clean every place that Mary possibly could have come in contact with at your dental office. Those steps, for as simple as they are the things that you want to do kind of going forward to start the ramp up, the transition to starting to treat patients. Unless you communicate this with your patients, they're going to be afraid to come back in. Your opening is going to take longer because you haven't communicated all the wonderful things, all the necessary things you want to do to keep your patients safe. So doctors, please, please communicate with your office team who are going to communicate with your patients. They need to know, patients and office team, that you have taken an enormous amount of consideration to keep them safe. Communicate all of that. Point number 2, opening your office. Stagger the scheduling of the patients. So in very efficient offices, we've got these people lined up one after another. Most offices have between 4 and 6 operatories. There's no reason to have a patient in operatory 1, 2, and 3, and then you're jumping between these chairs. You need to ramp this up slowly. Patients need to trust that you're keeping them safe. Put a patient in chair number 1, and in fact, put another patient in chair number 3. This way they're far apart. Now look, they can probably be in chair 1 and chair number 2, and we're still following the guidelines of being 6 feet apart. But psychologically, when patients realize, because of your communication, that you're staggering the appointments and you're keeping them far away from each other, and you're maximizing the amount of time that you can do environmental hygiene within those operatories, they're going to appreciate the efforts that you're putting in to keep them safe. Stagger appointments and stagger the operatories that are being used, and more importantly, communicate what you're doing for them. Also communicate this to the office team as well. Point number 3, you're going to confirm the patients before they come in. But here's the difference between the typical run-of-the-mill confirmation. This is an opportunity for communication. So you're going to explain to them the protocol. We're going to wait in the car. When they come in, they're going to be the only person there. There's going to be nobody else in the reception area. They're going to go straight to the operatory, or you're staggering the operatories for environmental hygiene. But here's the other thing you're going to add to the confirmation process. You're going to pre-screen their health history. You're going to ask them if they've had a temperature or a fever recently. You're going to ask them where they've traveled. If they've been out of the country, you're going to ask them if they've been to some of the hot spots in the United States, whether it's New Orleans or New York or California or the state of Washington or South Florida. You're going to pre-screen for all of that stuff. 99% of the time, their answers are going to be, no, I haven't had a fever. I've been to none of those places. And then you're going to respond to them. It's like, just so you know, it's so important for us to keep you safe. That's the reason we ask all of these questions. I hope you can appreciate the amount of care and love that we're giving you as our patients, because not only do we want to keep you safe, we also want to keep the team members that are going to be treating you safe as well. So remember, at the confirmation appointment, do pre-screening. It's really the best thing to do. So point number 4, and we've kind of talked a little bit about this, but consider adjusting the patient check-in process. So for example, if you're going to be having new patients come into your office, we don't want them to come into the office and sit there in a reception area chair filling out forms. So when you confirm that patient, you're going to tell them, if they're not able to do it online, what we want you to do is we want you to come into the office. We're going to have the forms ready for you with a pen and a clipboard and all the forms. Please go back out to your car, fill it all out. After it's filled out, call us. We're going to tell you when we're able to receive you as a new patient. All of these simple ideas, again, are meant to keep you and the patients and the team safe. The emphasis on all of this stuff, besides keeping everybody safe, is communicating the efforts that you're putting towards keeping everyone safe. That communication is going to earn you an enormous amount of points with the patients and the team, that you really are very conscious about the crisis and how you're trying to overcome that, and giving the patients and the team confidence that you're trying to keep everybody safe. Point number 5, restrict who can come into your office. A lot of times, older couples will go together because they want to support each other when they go to these dental appointments. Can't happen anymore. A lot of times, parents will bring their children along with them because they really have no other place to keep their kids, so they come in and they sit in the reception area while mom's getting her teeth taken care of. I'm sorry, it cannot happen anymore. You want to restrict the people that are coming into your office. So if an older couple comes and they need to come to your office, one of them's going to have to sit in the car. If they object to it, explain to them why it's so necessary to keep the number of people into your office down to an absolute minimum. And in fact, the only people that you really want in the office are those that are being treated. It makes perfectly good sense. A little bit of an inconvenience, people are going to have to kind of figure out how they're going to take care of their loved ones or their children or whatever the case is, but that's what has to happen. Now for pediatric patients, a little bit more challenging, because a lot of times mom and dad will go with that patient. But what you're going to have to do is you're going to have to certainly isolate the mom with the child and the treating team far away from somebody else. Now, in a lot of the orthodontic and pediatric offices, it's an open bay concept. Here's where social distancing really comes into play. And this is where you've got to stagger the chairs that are being used to treat these patients. It's going to decrease the amount of production that you're going to have because not every chair is going to be filled all the time, but that's okay. What you really want to do is preserve your business and save your patient population and have them to continue coming in. And the only way that's going to happen is if they trust you and the efforts you're putting forward towards keeping them safe and the office team safe as well. So number 6 is kind of an interesting idea, and it's kind of the antithesis of what we do as dental offices. So when you go into reception area of a dental office, there's magazines all over the counter space, there's displays, there's brochures of all the wonderful services that we're able to provide patients. All of that stuff has got to go away. In fact, when they're in the operatory and they're being worked on, all of the stuff that we normally have on top of the operatory, whether it's models and a sample night guard, it's models with a sample bridge or an implant, all of those things that are typically on top of our counter space, whether in the operatory, in hygiene, in the reception area, in the checkout area, all of the ancillary products and displays, they all have to be put away. When we do this, those are the kinds of things that you want to articulate to the patients. Hey, John, hey, Mary, when you come in to see us, it's going to kind of look very barren in our office, and we're doing that on purpose. We want to keep you and our office team safe, so anything that's not necessary for the treatment of the dentistry that you need is taken away from the counter space, because that's just a source of possible infection, and we don't want to take a chance for anyone. So clean everything up. You can either store it or you can throw it away, but you do not want to have anything laying around on top of the counter spaces in the operatory, in hygiene, checkout, or in the reception area. So number 7 is a variable that you don't really pay much attention to until you realize it. And that is the UPS and the FedEx delivery person who's bringing supplies and materials to your dental office. Person comes off the truck, they've got a box. Normally we let them into the office, they go to the front desk, they plop the box up on the counter, we sign the electronic receiving tablet, and then off they go to the next customer. I have no idea where that person has been. So here's how all that is going to change. When they want to deliver a package to your office, you're going to put a sign on your door and you're going to say, we want to receive the package, we will come out to you and pick up the package and sign it. You're going to go outside the office, you're going to electronically sign it, bring hand sanitizer with you so that anything you touch from the delivery person now is going to be clean from your standpoint. And if you feel comfortable, and I feel very comfortable doing this, I take the box and I'll spray it with a topical cleaner like Cavicide or something along those lines, and I'll put it on top of the cardboard and just let it sit there for a few minutes. That to me is giving one more barrier of protection between the delivery person in your office and the office team and the patients that you're treating. Articulate what you're doing above and beyond everybody else to your patients, to your office team, so they really understand what you're trying to do to keep them safe. Number 8 is going to be a little bit difficult for most general practices, but it's something that you need to consider, which is avoiding any procedure which is going to create an aerosol, which is not where you're not being able to contain it. So typically when a dentist is doing a dental procedure, that aerosol that's created by the high-speed handpiece is being evacuated by the dental assistant with a high volume evacuator, an HVE. That makes perfectly good sense. The other thing that you can do as dentists is use, if possible, rubber dams with all of your restorations. This way, if there is an aerosol spray, the spray that's being created is aerosol spray that's bouncing off of the rubber dam, not from within inside the patient's mouth. It becomes a little bit more challenging with hygiene. So in hygiene, they're either using a piezo scaler or they're using an ultrasonic scaler like a Cavitron. Dental hygienists typically do not use a dental assistant during that procedure. Since you're going to be lowering the amount of patients that you're going to see, and you're going to be staggering the schedule, what you may want to do is take one of the dental assistants who is typically dedicated to the restorative procedures in the dental office and assign that dental assistant to help with hygiene to reduce the amount of aerosol spray in the air. So you're going to have a dental assistant for a dental hygienist and a dental assistant helping the doctors. And when the doctors are doing procedures, please, please, please use a rubber dam as often as possible. And also use HVE all the time to keep the aerosol spray from getting all over the place. Number 9 is a new role in the dental office, and you can call it a lot of different things. I like to call it an environmental dental assistant. So what does that really mean? A dental assistant who's just dedicated. I know we've had these roaming dental assistants where they go into the operatory and wipe everything down and get everything ready for the next patient. What I want you to do now is to articulate that role to your office team and to your patients, that you have somebody who's dedicated to keeping the environment of the dental office clean, antiseptic, and sterile. So clean, obviously, wiping off the countertops, antiseptic, using a surface disinfectant like Cavicide, and sterile, which is you want to reemphasize that all the instruments that are being used, including the high-speed handpieces and the slow-speed handpieces, are being sterilized in an autoclave to make sure that there's nothing biologic alive on those instruments and those handpieces. Patients kind of know that we've always been doing this, and obviously we've been doing this for decades. Just reemphasize it, and reemphasize the point that you've got somebody dedicated just to wiping off the handles to the doors within the office that you're working on. Patients are going to love that, and they're going to know that you have their safety in mind going forward. The last one, number 10, is something that we as dentists have never done. Do we take temperatures of all of our patients before we work on them? And the answer is no, we just don't do that. So what I'm recommending to you is, as one additional screening proposal, is for you to take temperatures on all of your patients. And if their temperatures are slightly elevated, you're going to tell them that you choose not to treat them and that they should seek the advice of a medical professional. Now, there are some offices out there saying, well, I don't want to scare my patients because, then all of a sudden they're going to be offended that, they had a temperature of 99.1 and I told them that I want to treat them and they went someplace else or whatever the case is. You just can't take a chance in today's world. And in fact, those patients need to know that you have their safety in mind and that you're screening every person that comes in that office. Every office team member is going to get screened for their temperature every single morning. You're going to take your temperature and you're going to take the temperature of every person coming into the office. Is it guaranteed that you're going to catch every person that possibly has, non-clinical symptoms of COVID-19? No. But what it will do is take one additional step to trying to keep the people coming into your office is COVID-19 negative as possible. And that's really what we're trying to do. Screen every person, take their temperature, articulate to the patients, to the office team while you're doing that, and feel a lot safer going forward following these 10 steps. Number 1, communicate with your patients and your office team about all the great things that you're doing. Number 2, stagger the patients. You don't need to pack them all in. Use operatory and operatory 1 and operatory 3. Leave operatory 2 open. Number 3, pre-screen your patients at the confirmation call. Makes good sense. Number 4, consider adjusting the patient check-in process to keep the reception area free of anybody. You're going to have patients wait out in the car. Number 5, restrict who can come into your office. I understand that everybody wants to go there and give moral support. I'm sorry, that just can't happen anymore. Number 6, put away all the things that you have on your countertops in the operatories, hygiene, reception area, and checkout area. Get rid of all of it. We don't want a source for anything lingering around. Number 7, let's not overlook the personnel who are delivering packages to our office. The new protocol is going to be you're going to receive those packages outside your office. You're not going to let those delivery people into your office. Number 8, consider limiting the procedures done in your office. Or if you're going to continue to do all of the procedures, make sure that you do everything hygienically possible. It's all about the aerosol spray, and you want to eliminate that. Number 9, you're going to have an environmental dental assistant. It's going to be that person's job to make sure that that office is clean all the time in between every single patient. And going back to number 1, the previous things you want to communicate all the time. And the final thing, and probably out of everything we're going to do, which is going to make you the most uncomfortable, is you need to take temperatures on these patients before they come in. If the temperature's a little bit off, you're going to have to tell those patients you don't want to treat them today. They should actually seek medical treatment before going forward. So those are the 10 things you want to do. So I've talked about 10 things. I've expounded on all of them. Not really sure if I got all of them. And in fact, I know I don't have all the ideas. What I need you to do, along with me, is we need to spread the word to all of our dental colleagues. We need to get back to work, but we want to do it safely. We want to give our patients and we want to give our office team the confidence to come to work and to come to see us. And the only way this is going to happen is by all of us collectively bringing our ideas to the discussion. So please reach out to me, 954-683-2693, with any of the ideas that I've outlined here if you want to discuss them further and you don't really feel like, typing into the comment area. Or if you do, please add to it, because so many dentists read this stuff. I've got thousands of connections on LinkedIn and thousands of people on Facebook who look at all of this stuff. Please, 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 let's work together and try and get our practices open again.